So remember when I said everyone has strep and mono right now? Guess what my 4-year-old has? I'll give you a hint, it's not strep. Yep, she has mono. So she started with just a regular cough, runny nose, typical kind of viral symptoms. But then she started complaining of a sore throat, and I looked in her throat, her tonsils were red with a little bit of white spots on there. So even though she had a pretty bad cough, which we don't typically see with strep, I decided to take her to get tested because I had been seeing so many cases in the hospital. And her strep test was negative. So we're waiting it out, and at this point the only symptom she really had was a cough. Now coughs can linger, but this was a pretty nasty cough. Then all of a sudden, after about 16 days of just cough, she had a fever. And her fever lasted 2 days. And then she was complaining of sore throat again. So I had two things on my mind. Number one, mono. Number two, atypical pneumonia, which people often refer to as walking pneumonia. So I had them test her for both, and she tested positive for EBV, which is the most common virus that causes mono. So fortunately, mono is pretty mild when it affects young kids. Older kids, teenagers, and adults tend to have worse symptoms, and oftentimes they linger, they can have fatigue for weeks to months. And the important thing to remember about mono is that it can cause enlargement of the spleen. So we advise to avoid any kind of contact sports because you want to decrease the risk of having splenic rupture. Otherwise, it just takes some time for this virus to get out of your system and for you to start feeling better. If your child has been sick for a prolonged period of time, especially if they've had fever, sore throat, swollen lymph nodes, swollen tonsils, body aches, fatigue, they might have mono.